Hello, my name is Eric Rubenstein, and I am a postdoctoral fellow at the Weissman Center at the University of Wisconsin-Madison. I am excited to share with you the work that my collaborators and I have done that has recently been published in the journal Autism. Our paper is titled Associations Between Parental Broader Autism Phenotype and Child Autism Spectrum Disorder Phenotype in the Study to Explore Early Development. As it implies in the name, autism spectrum disorder, autism exists on a spectrum with a wide range of severity and levels in which it impacts a person's daily life. However, this spectrum exists beyond the bounds of a clinical diagnosis. We all fall on the autism spectrum somewhere. We call the area on the spectrum that has elevated autism-like traits, but not at the level warranting a diagnosis, the broader autism phenotype, or BAP. A parent with the broader autism phenotype is at greater risk of having a child with ASD than a parent without BAP. Since ASD has such a wide range in presentation, our group aimed to explore whether parents having BAP was associated with children with ASD having a specific type of presentation. We used data from the Study to Explore Early Development, or SEED. This study collected data on children 3 to 5 years from 6 sites across the U.S. For our study, we focused on 531 children with ASD who had completed measures on parent BAP for both their mother and their father. SEED collected a lot of data on the child's presentation, including information on diagnostic features of ASD, co-occurring medical conditions, and features like feeding and sleep issues that are common in kids with ASD. Using an approach developed by Dr. Lisa Wiggins and other SEED researchers, we took 27 of these traits that describe children with ASD and used a statistical technique called latent class analysis to create groups of children with ASD that had more similar presentations. We found 4 distinct groups. The first had the least cognitive impairment and developed language at the youngest age. The second had the most cognitive impairment and acquired language latest, if at all. This group also had highest rates of seizures. The third group had similar cognitive and language levels as the first group, but was more likely to have developmental regression. Lastly, the fourth group had typical nonverbal functioning and mild delays in language development. This group was most likely to have co-occurring issues like anxiety, depression, and feeding issues. After creating these groups, we examined whether a parent's BAP status was associated with which of these groups their child was in. What we found was that if either the mother or the father had BAP, the child was more likely to be in the fourth group, or the group with less social communication impairment and more co-occurring conditions. What this means is that parents with these mild autism traits are more likely to have children in this group that has lower levels of social communication impairment. This strongly points to a hereditary link for ASD in these families. We dug a little deeper and looked to see whether which parent that had BAP or whether the child was a boy or a girl mattered. Our sample size was a bit small, but we did see increased odds for this fourth class, whether both parents, the mother alone or the father alone had BAP, or the child was a boy or a girl. We think that this paper makes a meaningful impact. There is a lot of variability in how ASD presents, and we don't know much about how ASD cause affects presentation. Our results suggest that it might be more efficient to look for ASD-specific genes in parents with BAP and their children with ASD. Additionally, we developed an approach that we think can be used again to look at how other risk factors for ASD affect child presentation. Funding for this study was provided by Autism Speaks.